I'm Marcia Green, and I work with Christina Blanchard Horan. I've been assisting her, just on a consulting basis for the past year and a half or so. Thank you so much again for your participation.
Of course.
So, for this interview, as I stated before in the introduction, we sort of want to get your initial thoughts on, where the emphasis should be on the intersection between HIV and COVID-19. There's been some initial thoughts about maybe antiretrovirals offering some type of protection to people who were HIV positive. I don't think that that has been borne out by the research so far, but there's been, I think, other research that shows that they may be more at risk for developing severe complications from COVID-19 infections. So, just within the context of the current research, um, do you think that the research is in the right space, or do you think that there are things that are being missed? Where do you see the current state of things right now?
Those are all really important questions to ask and for people to think about. Actually, there has been a lot of research on all of these topics. And as you mentioned, most of it is inconclusive at this point. In terms of outcomes, I think the outcome data really varies. And what we're seeing is that as you break the populations down and get more granularity, there are specific subpopulations where the outcomes are worse, probably.
Mhm.
Um, and those outcomes may be especially focused on hospitalization and complications, but it's not like a general. There isn't some general statement I can make about the entire HIV infected population. It really depends, not just when I say subpopulations, it doesn't just depend on where their CD4 count is and their immune status. It also depends on many demographic factors, um, comorbidities, uh, even location, socioeconomic. So there are all those factors that play in, and that
Mhm.
is a really good thing for us to discuss. So we can talk more about that. The other
Mhm.
thing you mentioned was in terms of prevention and the relationship to antiretrovirals. You're right, that has not been borne out, but there is still research ongoing on that.
Mhm.
What what we what I usually use is the guidelines. So the COVID treatment guidelines for the HHS has a section on HIV,
Mhm.
and that section is updated rather regularly. Um, Based on my last read of that, there was no difference in what we do for prevention or treatment of COVID in the HIV infected population.
Mhm.
That may change in the future, but right now that's the best recommended practice.
Right.
It's the same issues in terms of vaccination, in terms of precautions, all those things. And that, that is one thing that I think would be important to discuss, is that everyone with HIV should get vaccinated. And then in terms of treatment, I would say we just use the same principles, follow the same guidelines for HIV. I don't know if you have someone else talking about that, or if you want to talk about the specifics of the treatment guidelines, but they're not really that different. And if I
Okay.
were, if I were talking about this and had limited time, I wouldn't focus on that because that's not unique to HIV. I would just
Right.
say they're basically the same.
Yeah. Well, that certainly it's very you certainly shed a lot of light based on what you said before. I wanted to just sort of switch gears just slightly and ask you a question regarding people living with HIV on the African continent. Many countries where the HIV epidemic is still, um, somewhat ongoing. And just looking at the intersection of COVID-19 there, actually, the African continent, I think, has not done terribly during the pandemic. based on the available data, they still have, a lower rate of COVID-19 infection relative to their population size, and also lower death rate. I was just wondering, you know, whether you think, what were your thoughts on that, and how do you see, the COVID-19 measures, whether there are any impacts on the overall HIV strategy for that region as well?
Th that is a really interesting topic. At
Mhm.
the beginning of the epidemic or early in the epidemic, it seemed like things were much worse in North America, in Europe, and then to Southeast Asia. Over the past several months, we have seen an uptick in the African countries, and there is great fear that a huge wave is going to overtake them, though we haven't necessarily seen that it has been worse than in other places.
Right.
Yet, I
Yeah.
do fear that that is a possibility.
Mm-hmm.
I don't know what the drivers are. So, is it a difference in exposure? Is it a
Mm-hmm.
difference in underlying genetic background or behavior or predisposition based on those things? We don't really know. Um, but people are looking into that, and it's interesting because if you think about what how sort of some resistance to HIV was selected.
Mm-hmm.
I don't know if you know this story, but when the Black Plague hit Europe, it knocked off a lot of people, and it turned out that the survivors, one of the things that helped them survive was a mutation in a certain gene. It
Mm-hmm.
turns out that that mutation in that gene associated with survival from the plague is actually associated with resistance to infection to HIV. And
Mm.
and there may be other selective factors going on like that that we have not yet identified.
Right.
It
Mm-hmm.
may also be that something similar to COVID has circulated at low levels in the African populations, and they have some level of immunity
Mm-hmm.
uh, that we didn't know about. For
Mm-hmm.
example, people talked about, like initially the thought was it came from pangolins. And then in certain countries in Africa, there were a lot of pangolins. So maybe there was constant exposure, and
Mm-hmm.
possibly that led to some baseline already, immunologic awareness and
Right.
and protection from the virus. We don't know, but that was, those types of theories come up.
Mm-hmm.
There may have been some selective process, but we don't know. What we do know is the virus is still evolving.
Yes.
So, and it will continue to evolve as viruses do.
Mm-hmm.
So even if there was some protective factor going on, that may be lost. The other thing to think about is this is a discussion not just about COVID, but it's about HIV and
Mm-hmm.
COVID. So the COVID has caused a tremendous disruption in HIV care,
Right.
especially in some of the lower resource settings. And it's caused drug shortages, it's caused difficulty with follow-up, and in places where people already do not have good access to things like computers necessarily, or phones, or they can't do telehealth visits, and they can't just connect like you and I are connecting easily. That's resulted in a lot of loss of follow-up, skipped doses of medications,
Mm.
less screening, less HIV diagnoses. There was an initial decrease in associated sexually transmitted infections, but we've seen that that has gone up, and they're not really being treated because people are not able to access care as much. So there there are a lot of issues associated with care and management of
Mm-hmm.
HIV that are affected by COVID.
Right. Right. Yeah. No, definitely. Yeah. And thank you for giving me your time today. I really appreciate it. Thank you so much.
Okay, no problem. Bye bye. Have a great day.
Bye.